Let's talk a little bit about fat. And this you heard from Dr. Esselstyn, Bob Vogel's discussion about decreasing the function of blood vessels, and I'd like to really talk about, separate them a little bit. Saturated fat. Rather than talk about physiology, I'd like to talk about cardiovascular mortality, and those who say that saturated fat doesn't do anything bad to you, they just are going against the literature. This is the British Medical Journal. Is that another vegan propaganda? No, this is another good peer review. It's interesting that they were talking about US study and getting published in Great Britain. I imagine there are a lot of rejections here in the United States, but we'll get over that. But higher dietary intake of saturated fat is associated with increased risk of coronary heart disease and coronary heart disease death. And this is the graph you probably want to remember. Trans fats are really the worst, followed by saturated fat, and probably, again, excuse me, some substitutionary benefit. Monounsaturated fat and polyunsaturated fat actually tend to decrease cardiovascular events. Let's talk about trans fats for a moment. Why do they even exist? It's because they actually make everything taste great. You can fry them. When you're looking for it in on your label, it'd be partially hydrogenated oils, and they are not considered safe, but they are inexpensive, and they give that great taste and texture. Restaurants use them, and it's been a target now for a while in several areas. And New York, you're very familiar with this because this is one of the places where they've done something about it. The bad side is the raising of LDL, lowering the good cholesterol, HDL, and it's uniquely associated with heart attack and stroke, as well as developing type 2 diabetes. And so this came out last month. Hospital admissions for heart attacks before and after the trans fatty acid restrictions in New York. So everyone in this room who backed this proposal should be congratulated. It's variable throughout New York, whether or not there are any restrictions at all. We're in Long Island, looks like it's restricted. Yeah? Good. And so this is what you saw. Now you could argue that those are small differences between the gold and the blue, but as we're decreasing heart attack deaths and stroke, it's decreased more if you have the trans fat restriction. Now imagine what this would be if you got rid of trans fat, saturated fat, high fructose corn syrup, and all the things that one could do as a government. You'd probably drive that curve down to zero, and that would be great. But this is proof of principle that passing a law that helps people's health, and it looks like the curves are close together, but that's several hundred heart attacks per year. And if that's a airline pilot in the air, I mean, these are pretty important. Okay, so anyway, there is good data that should be supported. We should be doing this all over the country, not just New York. So I did mention this last night, that the American Heart Association had come down on fats. They put out this presidential advisory and really talked about the fact that if you could replace saturated with unsaturated fat, you're going to improve your lipid levels, your risk factors, and your overall outcomes. Now, a lot of the fat that we're eating is actually embedded in animals, and so it's worth talking about this in the context of the high-protein diet. That is Atkins. That's the wonderful result that you can get with the Atkins diet, as long as you're alive. And so we do know, by the way, this was published very recently, so I stuck it in there almost off topic, but I hear that, that's a more complete diet. Not true. You get iodine deficient if you do that. But more important than that, than the iodine deficiency, which could cause some thyroid disease and be really annoying to the cardiologist because the thyroid disease people get so much atrial fibrillation. But more important than that, far more important, is that low-carb diets have been associated with increased mortality. The general population is a 22% increase, and if you take the people who have survived a heart attack, okay, it's a 53% increase in mortality. This is not to be played with. We should not be doing high fat, high protein, low-carb diets, particularly in people with heart disease. Now, what's the problem with it? Well, we've gone through the fat part. How about the meat part? Well, probably the fastest way to summarize the next few slides is that red meat kills, and processed red meat kills you faster. And so if you look very carefully at this, you see that the mortality can be avoided. First of all, it's linear. So the people who say, death in moderation, or they say, everything in moderation, they're saying death in moderation. When you go from 0 to 1, it's the biggest slope on these curves for increasing death rates. And anything that substitutes nuts, legumes, even poultry was better than red meat. And so that's what we should be focusing on. Processed and unprocessed red meat also have, one of the mechanisms is that it ruins the function of the heart. So it's associated with worse outcomes and more heart failure mortality. Heart failure is a growing problem in the United States, and the more drugs we come up with to stop people from dying, it used to be considered that's the cancer of cardiology, 50% death rate in 5 years. Well, guess what? We can improve that with drugs, and the more meat you're eating, the worse the outcome. You had a question? Yep. It's coming up. Thank you for asking. Okay. All right. So if you look at, rather than holding it off 2 slides, processed red meat is when you kill the animal and do something to it. Usually it started off to preserve it. So that would be ham, sausage, hot dogs. Help me out here. Salami, pastrami, lunch meats. There you go. That's okay. There you go. All right. Indeed. Nuggets. Well, actually, those are just fried, aren't they? Deep fried. Okay. All right. Actually, I think nuggets, I think that would qualify. I remember one of my colleagues in Mississippi was so concerned about them that he had them sent to his hospital pathology lab, and they found gastric mucosa in the chicken white meat. No, it was GI tract. So really, for those of you who no. You probably not this audience, all right? Okay. So back to meat kills you. There's a large amount of data, largely ignored. Pull up the research and just Google it. To pull up this study, prospective study, 500,000 people, a lot of death, and it's totally unnecessary. So I won't belabor the fact but it's linear. The more you eat, the more you die. Okay. Now. This culminated, I'm sorry?
What about vegan processed meat?
So we have no data that they're negative. If anybody has any, let me know. I'll put it on a slide, okay? I hear this all the time because there's this big division in the vegan community, whether or not, people should be eating veggie burgers, veggie hot dogs, all this stuff. It sounds like a terrible thing to do to a vegetable, but yes, you have data? Yes, lots of salt, massive amount of salt. And guess what? Hang on a second. I don't know, when bean burgers, they have plenty of fiber, okay? Yeah? I'd have to look at that. Interesting, okay? All right. So it would be nice to make this interactive, but I think we'll get in trouble if I don't finish, okay? All right, but thank you for that.